Thank you, thank you. My name is Mark Quirk, and I'm the Vice President for Medical Education Outcomes at the AMA. And I'm happy to be standing in for Susan Skoshilak, who couldn't be here tonight, to really welcome you to the reception. We're here to share some, what I feel is really exciting news. And we believe it's going to be news that's of interest to students who are here, to faculty, but also to the administration as well. But I want to take a minute first for some acknowledgments, which are very important. We'd like to thank the medical student leaders from the AMA's medical student section involved in coordinating tonight's event. If it weren't for them and their initiative and their commitment, this event would not be occurring. So you students who are out there need to thank them. And the student representatives are, and I'm going to read the list, Laura Halpin, Joy Lee, Katie March, and these are people from other institutions as well, and I'll get to that in a minute, but Katie is right here, fantastic. David Savage, John Schmidt, and Jamie Sparling. And thank you very much, Katie, particularly for everything that you've done for this here. We actually have 5 other schools that are involved: the Boston University School of Medicine, University of Medicine and Dentistry of New Jersey, Robert Wood Johnson Medical School, University of Tennessee College of Medicine, University of Texas School at Houston, University of Toledo College of Medicine, and of course Rush Medical College here in Chicago. We want to especially thank the staff and the administration here at Rush for hosting tonight's event. It's really wonderful to be across town and to have great neighbors like you. We really appreciate your help and your hospitality. We want to extend a special warm thank you to Dr. Tom Deutsch, who I believe is going to be here tonight. Dr. Deutsch, thanks very much. We really appreciate you being here. The Dean of the Medical School, thank you very much. There are many special guests across the 5 other sites. I'm not going to mention everyone, but I think it's important to at least acknowledge the types of leaders who are here. First, there are deans, associate deans, and we also have a Dr. Boyd, potentially, associate dean. Thanks for being here. Again, I think across the sites we have many deans and associate deans as well. Thank you all for coming, and faculty especially. I got to talk to some of the faculty here. You are medical education, so we're very thankful that you're here. Participating tonight, we also have many leaders in the American Medical Association, and they represent sections and councils who have really been integrally involved in the development of this initiative that you're going to hear more about over the last year and before. And I want to extend a special warm welcome to Dr. Alex Ding, who is an AMA board member in Boston, in our Boston site. And now I'd like to turn to Dr. Madera and the initiative. Dr. Jim Madera is the Chief Executive Officer and Executive Vice President of the American Medical Association. Dr. Madera joined the AMA in June 2011. Previously, he has served as the Thompson Distinguished Service Professor and Dean of the University of Chicago Pritzker School of Medicine, and as CEO of the University of Chicago Hospitals and Medical Center. He has also held academic positions at Emory and at Harvard, so he really knows what the challenges and the opportunities in academic medicine are all about. Since arriving, Dr. Madera has been committed to ensuring that the AMA plays a leadership role in helping physicians, residents, and medical students successfully navigate the changing healthcare system and the environment, and it's rapidly changing, and that's what this initiative is really focused on. During the past year, Dr. Madera has worked closely with the AMA Board of Trustees and his senior management team to help develop a 5-year strategic plan that really centers around 3 critical areas going forward. One is improving health outcomes. The second is enhancing physician satisfaction and practice sustainability through shaping delivery models, delivery and payment models. And then finally, the exciting initiative which he's going to talk to you about tonight, and that is accelerating change in medical education. Dr. Madera.
Thanks, Mark. So I just wanted to add my thanks for everyone joining us tonight. And on behalf of the American Medical Association, I hope you're enjoying the camaraderie, a little bit of a break from your studies. Not too long, though, because I know the dean and the faculty that are here are going to expect to see you first thing in the morning, ready to go. And it's no secret that your training is important because we are, among other things, facing a physician shortage. It's predicted that in just 2 years, we will have somewhere in the order of 63,000 physician shortage and asymmetrically distributed geographically and among specialties as well. And this means when your training is completed, you'll profit and will profit from you hitting the ground running, ready to perform in a high-functioning, team-based, patient-centric way. Now, I know this sounds a little daunting when you're thinking about your subsequent training, and as I mentioned to a couple of people earlier today, everyone frets over the match and what field they're going to go into because they actually like 3. But this is what I would call a high-class problem because there's no wrong answer. You have to choose among sometimes 2 to 3 to 4 right answers, so you don't have to worry about that too much. But I came to talk about this exciting new initiative at the AMA to help the evolving needs of our healthcare system in its delivery. And I'm really pleased to announce that the AMA is launching a $10 million competitive grant initiative designed to prepare today's medical students for success in the shape of tomorrow's healthcare system. Over the past 5 years, we have focused on medical education. We had projects on medical education, and within the last year, we now have established this program that in the next 5 years will award 8 to 12 medical schools grants to support bold, innovative projects that advance undergraduate medical education and align it with what we know will be different 21st century needs. So why now and why the AMA? Before I go into some detail around that, as a means of partially addressing these questions, let me just share a short video that helps touch on why the AMA is leading in this project.
The changes we are experiencing across healthcare today are unprecedented. It's fair to say the next few years will mark the greatest period of change experienced by physicians. The AMA believes medical education is one place where we need to meet this change head-on.
Physicians know that medical education of the past does not prepare us for the kinds of patient care that we deliver today or even tomorrow in the changing healthcare environment. There's a gap between what we train them to do at medical student education levels and residency levels. By the time they enter practice, they're forced to learn a lot of patient care skills on the job. We can do better for our students, and we can do better for our patients, and we want to make those changes happen now.
We need to focus on the learner and the learning process. We know so much more now about how people learn. The strategy needs to be visionary. The strategy cannot be incremental. Culture needs to be transformational.
Closing the gaps between current physician training and the needs of the evolving healthcare system in the 21st century is imperative. That's what this $10 million grant and RFP are all about.
We want to partner with others, with patients and other professions to get this done, to get this to a new, better state for tomorrow. This also reaffirms our historic commitment in medical education.
Change, innovation, alignment all need to occur for our profession to keep pace, and we must work together to make it happen.
We're partnering with medical schools that are committed to change, schools that are working on new, flexible, and outcomes-based innovations that will prepare our students for the healthcare of tomorrow.
We're excited about the future because it allows us to achieve our mission, which is simply to promote the art and science of medicine and the betterment of public health. The AMA is the only organization with the history, commitment, resources, and relationships to get this project done and done the right way.
To learn more about how we're selecting medical school partners, visit the RFP section of our website. The letter of intent deadline is February 15th.
I couldn't be more hopeful that together we will all rise to the occasion to make medical education the best that it can be for our future.
As the video indicates, we at the AMA have a long history of leadership in shaping medical education. In fact, in the early 1900s, when frankly snake oil and quackery were rampant, the AMA Council on Medical Education was formed and began visiting the nation's medical schools in an effort to raise educational standards. These site visits became the substrate and foundation for the famous Flexner Report and the implementation of the first standards in medical education occurred in this country. While these standards served us well for most of the last century, today I think it's widely appreciated that there is a gap that exists between physician training and the day-to-day realities of the evolving and emerging future healthcare system. So some examples. For example, today medical education focuses primarily on the individual, yet physicians increasingly practice in teams. Today, medical students receive most of their clinical training at many sites in an inpatient setting. Yet for every one person admitted to a hospital, 300 patients are seen in outpatient sites. And today, most medical students receive minimal education about the financial wiring of our healthcare system, and yet are responsible for the optimization of the spending of $2.7 trillion a year for the optimal outcomes of 310 million of our citizens. It is also the case that our curriculum as defined in the beginning of the last century is largely time-based and not focused more exclusively on competencies. So across the country, there has become a broad agreement that these gaps exist and that they must be narrowed. Many schools have embarked on innovative programs in a pilot way to advance medical education. Many more schools have conceived of innovative programs that they would like to begin implementing. The AMA wants to change that, lower the barrier for engagement. We want to bring schools together and foster and accelerate the kind of bold changes that will help you not only to succeed, but to thrive in this changing healthcare environment. So I promised you a few more details on the grant process, so here they are, as the video indicated. We have invited interested medical schools to submit a brief letter of intent by February 15th. Specifically, we're looking for creative ideas to enhance education in a number of critical ways. For example, developing new methods for teaching and assessing key competencies, fostering flexible, individualized learning plans, promoting methods to achieve patient safety, performance improvement, and team-based care, and improving the understanding of how our healthcare system works from a financial point of view and how we can optimize that for our 310 million citizens. We'll thoroughly review these ideas and invite a select number of schools to submit a full proposal. From those proposals, we will select between 8 and 12 schools to engage in a 5-year project. In addition, these schools will form a learning consortium so that the participating schools can share best practices and structural innovations. Ultimately, our goal is to showcase successful innovations and promote their adoption in medical schools throughout the country. Our official request for proposal was sent to the nation's medical schools, deans, and faculty because obviously, ultimately, they're the leaders who can and do make things happen in their respective institutions. Many of these leaders are with you tonight, and I want to thank them for their leadership. But I'll be the first to acknowledge that great ideas don't always come from the top. We want to hear from all of you, our medical students and residents, and you'll see this card that's distributed around the tables. You can use this card, and it will give you instructions on how to share your thoughts and comments by Twitter, by Facebook. The details for doing so, as I say, are on the card. Tell us about your training, what you like, areas that you think could be strengthened and improved. As a former dean myself, and I probably speak for Dean Deutsch as well, I don't think I ever met a medical student who didn't have a lot of ideas about how curricula could be improved. And this is the opportunity to really sound your voice. Now, speaking of sounding your voice, of course, I'm not here to recruit students tonight, but I can't leave really without saying just a couple of words about the AMA Medical Student Section, the MSS. To those of you that are already members, I want to take this opportunity to thank you. The MSS is the nation's largest medical student organization. There are 47,000 members, and it has a rich history. It was the MSS that called on the AMA to endorse the early demand for smoke-free workplace legislation. In fact, I was, a few years ago, part of the Smoke-Free Chicago Committee. At the time, I thought that originated largely from the American Cancer Society. And I spoke to the head of the American Cancer Society, who said, well, yes, we're putting a lot of resources toward this, but the idea actually came out of the AMA. And the idea within the AMA tracks back to the medical student section. The MSS also called on the AMA to endorse other changes for comprehensive health system reform as a top priority of the AMA. And as you know, the AMA supported the Affordable Care Act. President Obama chose our national meeting to roll this out. And each of the last 2 years, the AMA House has reaffirmed its support for the Affordable Care Act. And today, the MSS is busy responding to most of the pressing challenges for medical students. Medical student debt, GME slots, supported by the Medicare system. In just a few weeks at our annual National Advocacy Conference in DC, hundreds of MSS members will attend this lobbying effort where they will meet members of Congress and push for things medical students need. There's frankly nothing more powerful than flooding Capitol Hill with white coats. Everyone has a very personal connection to medicine. I used to tell my board of trustees at University of Chicago, they would say, what's so special about medicine? Why are we so successful in raising money? I said, it's because everyone in this room is pre-op. It's just a matter of timing. So in closing, let me thank everyone for joining tonight. I especially want to thank our medical students, not only for being here tonight, but for answering the call to serve our nation in what I think is the very best profession in the world. And as I said earlier, we really need you. We really need your voice and your actions and creativity in shaping the future. So I look forward to working with you, and the best to you as you pursue your studies. You will make all wonderful contributions. For the most part, there'll be contributions in areas that you don't currently guess you'll make contributions. The wonderful nature of our field is like that. So with those as just brief comments, let me open it up for a few questions and then turn the program back to the local sites for additional discussion.
Great, thank you, Jim. As I said earlier, I'm Rodrigo Sierra. I'm the Chief Communications and Marketing Officer for the American Medical Association. And I'll add to your list, Jim, of the leadership that MSS has shown, that it is the leaders of the regional MSS organizations across the country who are responsible for bringing these great groups together tonight, who have done the hard work of helping us get the sites, bring their colleagues, their classmates, and everyone else together. So we're really grateful to all the members of the MSS across the country who have done that. In terms of the questions, for those of you in our remote sites, now would be the time, if you're interested in asking a question, to email those in to the email address that you've been provided. We have people here who will look through those and bring them to me to ask to Dr. Madera. But we're going to start right here in Chicago at Rush with the person who has made this event happen here today, Katie March. I want to thank you again for helping us to organize it. And I understand you have a question for Dr. Madera. So if you would please come to the mic and ask it. That way everyone in the remote sections can hear it as well. Thank you.
So my question for you is, has there been any discussion regarding how changing medical education will impact the cost of medical school attendance? And are there any plans to address the cost of attendance within this initiative?
Yes, so there are a couple pieces to that, I would say, Katie. The first is once one moves to a competency-based curriculum away from a time and chair curriculum, that the 4-year clock is no longer on. And one could shave off a training by establishing competencies early. The second, I would say, is that there are advances in education and simulation allow for, I think, a higher degree of efficiency and cost savings. That's been demonstrated in other educational spheres. I said two things, I'll add a third, and the third is simply that every site that educates students has its own pressures, and they're all, if you've seen one, you've seen one. Each one is different. Having said that, there are many sites that have billion-dollar-plus clinical operations. And I think if one applies some pressure to clinical thinking so that one can claim one place in the priority chain, there is also another opportunity to modify student debt.
Thank you, Jim. And for here, the folks here in Chicago, if you do have a question, just feel free to come up this way. I'll be happy to give you the mic and let you ask it. And as we wait for questions from remote sites, we do have a couple that were sent in earlier. Here's one from the University of Texas Medical School at Houston. What role do you see for quality improvement and other student-led projects in medical student education?
Yeah, so I think any innovative curriculum will focus both on quality and, of course, value. In fact, our feeling is that payment and delivery systems that aren't defined by quality and value are not part of this future state. And the curriculum is really all about preparing students for this future state. So quality, value, these will be very important parts, I think, of any successful next phase innovative curriculum.
Great. And we have another question here at Rush from one of the students. Come on up, Naveen Kasari.
Hi, Dr. Madera. Thank you for your talk about today. You mentioned earlier about educating students about the financial aspect of medicine, how it's a $2.7 trillion industry. How about the legal aspect that troubles a lot of physicians today?
Yeah. Well, there is certainly evidence that defensive medicine is a cost driver. I think the best evidence demonstrates that it's not as major a cost driver as some think. I mean, it's important, but it's not the critical driver. Having said that, it is really for an individual that dedicates their career to the treatment of patients to find oneself in a court case, even court cases that are frivolous and even court cases that are settled in the favor of the physician, really does a lot of psychological damage to physicians. So our position as an organization is to have sensible caps and sensible procedures for eliminating frivolous cases.
And we have a question from the University of Toledo College of Medicine and Life Sciences, where, by the way, I want to give a shout out to Dr. Gold, who I know is in the audience there. He was one of the featured speakers in our video, and we thank him for his support and energy around this initiative. Question from University of Toledo College of Medicine and Life Sciences: how does the AMA plan to work with other stakeholders in medical education, namely the LCME, NBME, AAMC, and ACGME, to ensure that the novel and innovative ideas for the future of medical education developed under the initiative are implemented in schools across the country after they're determined to be successful?
A couple of the characteristics of this focus area of ours, but the other two that we weren't dealing with tonight, are that it's outcomes focused, number one, but to get to an outcomes focus, one has to partner as well as do. And these organizations are all our current partners, and we have spoken to all of them. Frankly, I personally will speak to my friend Darrell Kirsch, who's CEO of AAMC, on a regular basis to update him. So this is a widespread partnership, and these elements of interaction are critical, as the question would suggest. And so we got on top of those early.
That's great. And we'll do one more. And again, if you have any here in Chicago at Rush, please feel free to come up. But we'll do one more that's also from the University of Texas Medical School. How do you feel that schools can move forward with rapid innovation in education without jeopardizing student performance on the U.S. MLE STEP exams or NBME shelf exams?
So a target of this education is to instill quality and competence. It's to make things better, not worse, and to follow in a measured way progress on exams such as these. I should also say we have to, when one thinks about the future in kind of a disruptive way, one can imagine a lot of reasons not to change. And I think this is why we have a stack of reports all suggesting we change in the same way, and we aren't there yet. So these are issues. It's good that this issue was brought up, but the approach will be to follow this in a quantitative, measured way, and of course we'll be measuring quality outcomes for student competencies.
And our final question from here in Chicago from a reporter from AM News, Kevin O'Reilly.
Dr. Madera, will you be looking for applications that are focused on out-of-the-box ideas that haven't really been tried anywhere, or things that have some evidence base already to show that they work? Thanks.
We would like a mixed portfolio. If it's out of the box, we would like to understand that there's a faculty and leadership commitment to that at that institution. Another aspect that I think will come out of this is that we suspect that an ideal optimized system for medical school student training would probably have a lot of flexibility in it. And schools may have different interests, and so perhaps one set of standards is just a baseline. If they're right standards, they're chosen carefully, they're not too numerous in numbers. But we're looking for a learning consortium where organizations can try different ideas. So we're looking for a portfolio of ideas in terms of risk.
And only because I have command of the mic, I'm going to add one more question. Just came in from Boston University, where we want to give a shout out to Dr. Alex Ding, AMA board member who I know is there helping to host the group there, and we thank him for that. How does the AMA see curriculum reform addressing the public health issues of today, such as the obesity epidemic?
So one of the issues that I have to say that is important in medical education are the social science dimensions of medical education. I said at a recent meeting, a 2.5-day meeting where it was more bioscience oriented, to comment and give a summary of where capital was being missed. And we all can think of ways of spending efficaciously more money clinically, but we spend $2.7 trillion. It's hard to imagine a really strong argument that that's not enough. We have pressure on NIH funding that is daunting, but all in with NIH, big pharma gifts, there's about $100 billion a year in biomedical research funding in this country. It's hard to argue that that's an inappropriate number, but when we search for problems, often the problems are around issues of care coordination, research alignment in biomedical sites and academic sites with industry, a provider split, non-recognition of the social needs, the increase in diabetes and obesity in this country. So I would argue that our lack of capital that's rate limiting is not financial. I don't think it's human. We have fabulous people. I think it's social. I think our rate limiting barrier is social capital, and it gets to this point of social burdens of disease, such as obesity as well.
Great. Thank you, Dr. Madera. We appreciate your time. At this time, we are going to sign off from Chicago. We invite you to continue the discussion at your various locations or just take some time to grab a bite and visit with your colleagues. We appreciate the thoughtful questions, and we'll follow up with our student host to provide answers to any that we did not get to tonight. On behalf of the AMA, I want to thank our MSS student leaders, Katie, Joy, Laura, David, John, and Jamie, for hosting tonight's event, and thank everyone for taking time out of their busy schedules to be with us tonight. The AMA is very excited about the opportunities that lie ahead to help enhance medical education in this country. We look forward to working with you in the days and months ahead. And we'll return it back now to the local sites. Good night, everyone.